All right. Welcome to the infant development portion of this growth and development series. So, in this video, we're going to focus specifically on infant development, which covers birth through approximately 1 year of age. Now, this is a high yield HESI topic, especially when it comes to growth milestones, feeding, safety, and normal versus abnormal behaviors. When HESI asks about infants, they want you to know what is normal, what is expected, and what requires intervention. Infancy is a period of rapid growth and development. During this time, infants are working on several key developmental tasks. These include weaning, learning locomotion like rolling and crawling, beginning self-feeding, and starting language acquisition. None of these happen all at once. Development is gradual, and variation is normal. So for HESI, if the task matches the age, it's normal development. Several major developmental theories apply to infants, and HESI expects you to connect them correctly. So, according to Erickson, the infant's main task is trust versus mistrust. When caregivers consistently meet the infant's needs, think feeding, comfort, warmth, the infant learns the world is safe. So, consistent caregiving, remember, builds trust, not independence. Now, according to Piaget, infants are in the sensory motor stage. They learn through their senses and physical interaction, touching, tasting, moving, and exploring. A major milestone in this stage is object permanence, which usually develops around 8 to 9 months old. If a baby cries when a caregiver leaves, just remember that object permanence is developing. Now, lastly on this slide, we see Freud, who described infancy as the oral stage. Infants explore the world through their mouths, sucking, chewing, and mouthing objects. Basically, an infant will put anything in their mouth that they possibly can. Now, this is normal behavior, not something that should be discouraged unless it creates a safety risk. So remember, oral behaviors in infants are expected, not pathological. Now, growth patterns during infancy are very predictable and very testable. Birth weight doubles by about 6 months. I'm going to repeat it. Birth weight doubles by approximately 6 months of age, and birth weight triples by about 1 year. I'm going to repeat it again. Birth weight triples by about 1 year. Now, consistent weight gain is a key indicator of adequate nutrition and overall health. Separation anxiety and language development. Around 6 months, infants may begin to show separation anxiety. Now, this is actually a good sign. It shows attachment has formed. Language development includes both receptive communication, which comes first, we receive it, and then expressive communication, like babbling and early words. Okay, so understanding language comes before speaking it. And as a reminder, we have that egocentric behavior. So 1-year-olds relate all experiences and objects to their own bodies, This is normal. They aren't able to conceptualize that other people can view the world differently or that other people even exist in it. And nutrition. So, nutrition during infancy is critical. From birth to 6 months, breast milk is the ideal nutrition. Now, mind you, real world, we care that the baby is fed, whether it be breast milk or formula. Okay. Per textbook, breast milk is going to be the optimal choice. Okay, because we're getting all of those antibodies and nutritional benefits from the mother through breast milk. But again, real world, we just want to make sure that baby is fed. Now, solid foods are gradually introduced around 6 months. Okay. Now, with that, some of the main things is we want to make sure that the infant can sit up independently. So that way we don't have an increased risk for aspiration. If they were to topple over and still have food in their mouth, we don't want it going down and being lodged in their airway. Now, at 12 months, whole milk may be introduced. Okay. However, low fat milk should be avoided before age 2. Our littles, they need the fat from the milk. Okay, so whole milk is our option at 12 months. Now, the most important dental problem in infants is nursing caries. Okay, so this is also known as baby bottle tooth decay. So this happens when infants are put to bed with bottles containing milk, formula, or juice. We should not be doing that. Okay, nurses should teach caregivers to clean the gums and teeth daily and never allow bottles in bed. Now, infants need freedom of movement to develop their motor skills. Tummy time, reaching, crawling, and cruising are all essential. Time spent in car seats, swings, or restrictive devices should be limited when not needed for safety. Now, it's important for this because movement supports brain development. So it's not just the physical aspect of it, but we are making those neural connections when we are allowing baby to move freely. And you see on the right hand side of the slide here um, some different developmental milestones that we see in accordance with physical activity. So, like 9 months old, we see the pincer grasp. So, being able to grab small objects with the thumb and the forefinger. Before this, we see infants if they want to grab something, they take their entire hand and they just kind of like slap onto it and try to claw at it. For 10 to 12 months old, cruising, this is walking while holding furniture for support. And then typically 12 months and beyond is when we see the first independent steps, when baby starts beginning to walk without assistance. Now, safe sleep practices. Again, critical for infants. Infants should always be placed on their backs to sleep and for every sleep. The crib should be empty. Okay, no pillows, blankets, bumpers, or toys. So what we see in this picture here, that already is that's hazardous. We see a pillow behind that baby's head. We see a free floating blanket underneath the baby that could easily be, moved if the baby were to move during their sleep. So This is going to, like I said, be huge. Um, I have often seen questions on safe sleep practices and SIDS prevention. So just remember to have them by themselves, right? Firm, flat sleep surface, cribs are empty, um, and to room share without bed sharing. Now, for home safety, when an infant is first born, there isn't as many of these safety risks. However, when infants start to become mobile, they become mobile. So, injury prevention then becomes a priority. So, this includes outlet covers, locked cabinets, stair gates, water safety, burn prevention, choking prevention. Nurses should educate families before mobility increases. So that way we can try to prevent these things from happening rather than just trying to play catch up or to, put out the forest fire that was already created. Now, to wrap up infant development, remember this. Growth is rapid. Trust is built through consistent care. Oral behaviors are normal, and safety and nutrition are priorities. Supporting families during infancy sets the foundation for lifelong health. All right, that is our infant. So meet me in the next video so that way we can go ahead and talk about early childhood development. I'll see you in the next one.